is currently under 11 p.m. to 4 a.m. curfew without any lockdown after the president reviewed stricter measures initially imposed to curb COVID-19. So now, even as we wait for that meeting between the president and the governors, and as Uhuru meets governors, the rising COVID-19 infections have thrown the school calendar in disarray. Now, the government appears to be in a dilemma of a full reopening and running of the education sector, unless the arrest of learners resume by latest November 2nd. We may be staring at a possible syllabus crisis, with learners facing the harsh possibilities of repeating classes. But what possible reopening options does the government have? Shadrack Miti examines.
After learners in grade 4, class 8 and form 4 resumed learning on October 12th, their colleagues in PP1 and 2, grades 1 to 3, classes 5, 6 and 7, and finally forms 1 to 3 were expected to start reporting on October 26th. Thanks to a spike in COVID-19 infections, the plan fell through. Nevertheless, Education Cabinet Secretary Professor George Magoha has maintained learning for the three critical categories of learners currently in school will continue. A stand supported by the Kenya Secondary Schools Heads Association chairperson.
Our children are at school and they will remain there, the three groups that are there.
It would not be wise for us to send these children back home, especially those in boarding schools, because they are relatively safer within.
Kahi Indimuli, the chief principal at Machakos School and the chairperson, Kenya Secondary Schools Heads Association, says the COVID-19 pandemic is slowly becoming a full-blown education crisis.
We know the effects of prolonged closure to the children. Apart from the known teenage pregnancy and drugs, it's a medical problem, it's a medical challenge, but let's not allow the medical challenge turn into an educational crisis for this country.
Term 2, which began on October 12th, would end on December 23rd, with another 11 weeks for Term 3, set to run from January 4th to March 2021. However, this plan would only work assuming full reopening takes place by latest November 2nd. Critically, the government may want to redesign the curriculum in order to allow for the academic calendar to be normalized and harmonized by 2022.
Should this continue, that the other children cannot be brought in, but we remain with the candidates, class 8s and the rest until they sit their exams, then it will require that the stakeholders and curriculum designers and developers must sit down and now think of how do we transit the children to the next class. For example, once the class 8 sit KCPE, they will be expecting to join Form 1. And as things stand, we have a group of Form 1 students who are yet to finish their coursework of Form 1 and then transit to Form 2.
A planned crisis meeting next week will discuss various possibilities, key among them the proposal to alternate classes. This, however, can only work for day secondary schools, but with a lot of challenges. For primary schools, the government might consider learning in shifts.
It would mean you'd need 2 sets of teachers in order for us to do this kind of tracking system. So that track 1 has a set of teachers who will close and go with their children. Track 2 comes in with another set of teachers who will do their track.
Meanwhile, school heads are now demanding for each school to have a qualified medical staff on standby for quick detection and attention to COVID-19 cases. This even as it is emerging that teachers do not have a medical insurance cover in case they contract COVID-19.
Now we are learning that the medical insurance cannot cover pandemic, but we are in a pandemic situation and people are going to fall sick. Therefore, and teachers now have become frontline workers, given that we have the children in our schools.
Shadrack Miti, KTN News.
All right, so I'd like us to speak to Dr. John Njenga Karugia, a lecturer at the Goethe Frankfurt University in Germany, on the situation in Germany in relation to schools reopening. And thank you so much, Dr. for talking to us here on KTN News Center this morning. So in Germany, numbers are, there is a high rise in numbers of COVID-19, the same thing that we're seeing here in Kenya, but schools are still opened. So what measures did the German government put in place to ensure that schools are not closed?
Yes. Thank you very much for having me. In Germany, we have had, as per yesterday evening, we have had 560,000 cases, of which 371,500 have recovered, okay? And we've had 10,661 deaths. And of course, we have been struggling with our children and on the issue of school. So what I know is Germany is divided into 16 states. And so these 16 states have varying education systems, if anything, and they have varied policies on COVID-19. In schools that I have been able to personally, because of my family, see, children have been divided into groups in classes, okay? And these children that are divided into various groups are only allowed to play together. Yeah? They have to wear masks when they are in classrooms. And once they sit down, while they're walking around the school, they have to wear masks while they're in the building. And when they sit down, they may remove the masks, and one group stays together. And that is helpful because when one group is sitting together in the classroom and playing together in the playing grounds, then traceability is easier, because then you're able to say that if one family reports a case of COVID-19 amongst them, you don't have to close down the whole school. You're able to trace and actually probably just test the group that is affected, whose member is affected.
All right, so Dr. Terry, let's... Just finish what you're saying.
So, and then of course, parents are not having, parents' meetings in school. If you have to make inquiries about your child, you do these only by phone, amongst other measures.
So, Dr. Terry, let's translate, what you've explained to us, what the German administration has put in place to ensure the safety of children. So we translate it back, what the government in Kenya needs to do, because immediately after reopening, several schools here in the country were closed because of infections. Infections have been reported in terms of teachers contracting the virus and also pupils and students.
Yes, are you talking about the measures they should put in place, or the measures they're put in place?
I'm talking about the measures that the Kenyan government needs to put in place, because you've explained to us what the German government has put in place to ensure that schools do not come, a center for the spread of the COVID-19. So what the Kenyan government needs to put in place to ensure that as much as schools are reopened, you do not see more closure of schools.
Okay, so of course, the issue of traceability is important, and wearing masks and dividing the groups in such a manner that you can actually trace back to a certain group and not close the whole school, as I've said. But one other important thing that has been happening here is there's an important German word. It is called Stoßlüften. Now, what is Stoßlüften? And there's a lot of literature. In fact, the biggest daily newspaper in Germany, Die Zeit, has recently published a 10-page feature about Stoßlüften. Stoßlüften is the idea of ventilation. So ventilation is very important. I talked to one teacher who is a friend, and she told me that in her class and in many schools, teachers are being encouraged every 15 to 20 minutes. They have to open all windows and doors and actually allow for air to flow. This is a tradition of winter anyway, because we have to keep changing warm and cold air, the aeration of the room and the air conditioning and all that. And so this teacher told me that she has set a clock in such a manner that every 20 minutes she opens her windows, all the windows in the classroom, for 3 to 5 minutes, just to allow for fresh air to flow. So that is something that is being insisted upon here.
Right.
And I think it is helpful because, I mean, globally, people are definitely, there is that discourse of ventilation. Right?
All right.
So
right.
traceability, ventilation, avoiding unnecessary contact between teachers and parents. You can actually just let your child off the gate and not necessarily walk into the school with his children.
All right. So,
but the issue of traceability is very important.
All right. So, Dr. Ari, can we say then the risk associated with reopening has a lot to do with the level of virus circulating in a community and not within the school setup?
Well, yes and no, because COVID is actually all over. But basically, what I see is people taking a lot of precaution in the sense that you have to keep. So there's also the value of honesty, that if you have the symptoms, you have to report them to the school, or you have to report them, of course, to the doctors and pull your child off the school, at least until you're sure, until a test has actually been done. Huh?
So are we saying that the important thing now we have to do as a country, you know, as Kenya, is to try and have the numbers in the community as low as possible? Because if the numbers are high within the community level, then it means that the infection will definitely be taken to the schools.
Yes. You know, when I see political campaigns, that is already, you know, the wrong signal, because you're basically telling the population it is okay to continue interacting in these huge numbers. So it is very, very important to, you know, socially distance. And, you know, there are some vaccines that are being developed. People should just be patient with their lives, whether they are political or economic lives. And I know that is very difficult when incomes and livelihoods are actually on the line, but there is no other way of it. We are in a second partial lockdown here in Germany, and it's just horrible. Because also here in Germany, despite the government policies that were put in place, you know, people did not listen. Yeah, so people basically need to listen to what the Ministry of Health is telling them. And some of these things probably, you know, we say are common sense, but common sense is not common to everyone, as we realize. And we need to have solidarity and empathy with, you know, with our neighbors. Don't visit people unnecessarily. Don't, you know, just go to those places where you need to go and really wear a mask. I was taking a walk in the city where I live, and yesterday, even in public places, now people are taking it very seriously, and people are actually wearing masks.
All right. And you know, there is a debate, you know, a split debate between public health experts about schools having been identified as a driver of infections. And there is a split because whether the reopening of schools, the schools here in Kenya were reopened last month, and which people are trying to see, you know, public health experts are trying to see whether a fresh spike in cases or whether the rise has more to do with, you know, the traveling because the inter-county borders have been opened.
So I'll just, you know, translate that again to here. We have seen different, what you would then call back at home counties, we call states. Germany has 16 states. And what we have seen is one state during the whole COVID time once one state closes down, locks down some businesses, be it hotels, and now we're talking about the Christmas markets because we have a huge Christmas tradition here in Germany. Epidemiologists have actually called for uniformity in policy making, that the 16 states should not basically have different policies for each state, because what we have seen is once there is a lockdown of some businesses like hotels or even now we are expecting Christmas markets, people will move to another state. So it is important to have that uniformity and to say the 47 counties should, sit down, and it is not for me to prescribe anything really, but sit down and have, uniform policy making. That is something that also Germany, in the name of its big democracy between the federal state, the federal government, and then the 16 states, is also struggling.
All right. And with the situation here in the country, it's just partial reopening of schools. And, we also heard from the Kenyan CS for Education, Professor George Magoha, saying that the children who are in school, that is grade 4, class 8 and form 4s, are way safer in schools than being at home. Do you think the government should just go ahead and fully reopen the education system?
I have, so again, whatever is known about this virus is still, we do not know very much about it, right? So that is also a global condition, and we also know much about it. But what I have seen here is there is also the partial reopening is not a bad thing, so that teachers are not burdened all of a sudden. And I think it is a good thing to as Professor Magoha and the Ministry of Education has been doing, to actually reopen slowly and not reopen fully, because teachers have to relearn how to coexist with their students in these conditions, right? So the idea that when you go into a classroom, you have to have groups like we have here for the sake of traceability. This is already in-service training on the job, right? Because they have not been trained to do this before. While you're walking around the classroom as a teacher, you actually, wear a mask because you're now meeting the different groups, right? When you're having meetings with a parent who really you have to wear masks and so on and so forth. And all these nitty-gritties of when do I wear a mask, just the materiality of it. When do I hold these and wear these and move and all that? These are things that I think teachers need to practice with smaller groups, and I've seen it happening here in that sense. My son, who is in kindergarten, they had a system when they reopened for the first time, where they actually split the kindergarten group and physically put fences for traceability, and they put little fences and all that, and they had to train the children that you cannot now play usually here on these grounds. You have to stay within your group, and these are things that kids also need time. So if you reopen the whole school, and with the whole population, and again it depends on the number of children, the number of students that you have in your educational institution, it might actually overburden teachers. And remember, right. There is now, teachers want, definitely, and I think it is probably their responsibility, right? So how do you balance between reassuring children that all is going to be fine,
right,
not causing panic, and ensuring that you yourself are also, taking care of yourself and the children. I think these need baby steps.
Right. Thank you so much. At that point, I'd like to say asante sana Dr. John Jenga, a lecturer at the Goethe Frankfurt University in Germany, talking to us about reopening of schools and just telling us what Kenya can learn from Germany right there. But then back home, we spoke to a section of Kenyans in Voi on whether or not schools should be reopened fully and the way forward in the fight against COVID-19. Listen in.
COVID-19 ama corona ni ugonjwa ambaye tumesikia madaktari wakisema kwamba ni ugonjwa watu wataishi nao. Utakuwa katikati ya watu huu ugonjwa. Hatutaweza kuepuka, wala ni ugonjwa watu wanasema kwamba hautaisha, utakuwa unaishi pamoja na watu. Na kama ugonjwa kama huu utakuwa unaishi pamoja na watu, je, shule zitakuwa zikifungwa mpaka lini? Kama ugonjwa utakuwa miongoni mwa watu, unaishi na watu. Langu mimi ninaomba ni serikali iengeze wahudumu wa afya, na kila shule ikiwezekana ipewe wahudumu wa afya ili kuweza kulinda na kuangalia watoto wakae katika distance, wafundishwe katika distance, wavae barakoa, wakae na maji na sabuni ya kuosha mikono. Yaani serikali iengeze wafanyikazi wa afya. Maana huu ugonjwa tukisema watu tumemalizika, ni ugonjwa unaishi na watu. Na kama ugonjwa unaishi na watu, sasa tutakuwa shule zitafunguliwa maisha.
Mimi nasema kwamba wasifungue. Kwa sababu wanaposema wanafungua na tayari tumeona shule kadhaa zimefungwa kwa sababu ya huu ugonjwa. Sasa wafungue shule kwa nini? Yaani wahatarisha maisha ya wanafunzi wetu. Kwa hivyo mimi naona kwamba wasifungue. Hata vile nimesikia mwenzangu wa kwanza amesema kwamba serikali iongeze madaktari. Yenyewe haina hela ya kuongeza. Kwa hivyo sasa hii ni mambo mengine ambayo tunaleta kwamba lazima serikali iangalie mambo ya kesho kwa kizazi cha kesho. Miezi imebaki ni miwili, wangojee mwezi ishe, tungojee Januari shule zifunguliwe fresh. Lakini sasa hii hata zile ambazo sasa hii wanafunzi form 4 wako shuleni. Sawa, 8 wako shuleni. Class 4 wako shuleni. Wale wengine wako nje form 4 ambao wako nje sasa hii. Wale wako nje, zile shule zao zimefungwa. Watasoma kivipi kama na mtihani wanangojea mwezi huu ujao wanafanya mtihani? Tunaona kwamba hapo kuna lazima tuangalie kote kote.
Kama sasa hivi tunasikia idadi ya corona inapanda. Serikali inatuhakikishia nini? Inatuhakikishia uhakika gani kwamba wakirudi shuleni watoto hata wapatwa na ile janga la COVID? Because already tukiongea Mombasa tunaonoka. Tumesikia headmaster alikufa. Hiyo ni experience tumeona. Hata kulingana sasa walipofungua shule wameona kwamba hii kitu sasa itakuwa tatizo watoto wa shuleni. Kwa nini tunaona wazi kwamba kuna tatizo? Tunaona moto, tuingie kwa moto. So mimi kama mzazi naomba watu watulie, wae na subira, wajua kwamba mpaka tuone kumekuwa vipi ndio shule kamili zifunguliwe.
Hiyo ugonjwa hauko shuleni tu peke yake, hata nyumbani iko. Tungeonelea ni vyema tumuunge mkono waziri, watoto warudi shuleni, kwa sababu watoto wengi wamepoteza maisha yao kwa kukaa mwaka mzima bila kuwa wanasoma. Sisi hatuoni vizuri watoto wakikaa nyumbani, yale ambayo tulikuwa tukiwalinda wakiwa nyumbani. Hata shuleni mwalimu na wakuu wa shule wataangalia, maana shule wanajua mipangilio vile waliambiwa waweke distance, watoto wasome.
Kuhusiana na hili jambo la corona, watoto wasifungue shule sababu hata sisi wazazi wenyewe hatuna fedha, hatuna pesa za kuregesha watoto shuleni. Kulingana na corona, wazazi wako na changamoto sana ya kupata chakula, kupata pesa za kusoma ni shida kwa saizi. Sasa tungeonelea shule zikae hivyo hivyo mpaka mwaka ujao ndio shule Januari watoto wafungue na wazazi watakuwa wameshajipanga.
All right, so that is what the residents in Voi had to say about the reopening of schools. But then the launch of the BBI report led to increased political activity as leaders drum up support for their stand